I've got Mary here. Mary is what, about a month out from surgery?
Yes,
Give or
5
take?
weeks. Yes.
5 weeks, okay. So 5 weeks, we did basically a full face rejuvenation on her. Deep plain face, deep neck, some fat, deep chemical peel, whole 9 yards. Okay, so first of all, a couple of special things about Mary. I did Mary's case with her completely asleep, okay, which most of my cases I do under local. So a little bit different from my standard mojo, okay? Take it away. What do you feel? You recently got back from an out-of-town visit. You've had people look at you. Feedback.
I'm so glad I did this. I put it off for probably over a year. Well, it has been over a year. And I was very nervous, and my jowls were really bothering me because they were drooping, and other parts of my face. And I Googled doctors, and part of it was afraid of going under, but it was the best decision I could have made. And I'm so glad I choose, Dr. Othray. He's been amazing. He did a great job. I healed quickly. I feel great. All my friends are telling me I just look like a new person, refreshed. And even another plastic surgeon that I know out of state just said, give kudos to your doctor. He did a great job. He could not believe at the time. I was probably 3 weeks after surgery. No one could believe it. And I'm so happy.
Good.
I mean, I'm thrilled.
I'm gonna ask you a lot of deep questions, Mary, okay? How long total were you thinking about doing something, anything?
Honestly,
Yeah.
before I did it, probably 3 months, 2 months.
Okay, so up until the 3 months prior to you doing it, you've never thought about doing anything.
Oh no, I've thought about it.
So how long total? Ballpark it.
2 years.
2 years. What happened, say 2 years ago, where you first started going, I wish I could? Is there something that happened, something that changed, something you saw? What was that feeling like?
You know what it really was? I was using this clear tape to tape up my jowls and my neck and stuff. And I was somewhere where I really needed it and I ran out of it. And I basically said, screw it, I'm going to get it done.
Okay.
And my husband just says, whatever makes you happy.
Yeah.
And he's happy, he loves it, but it was a tough decision. But
I can imagine.
Yes, but anyone who is, flip-flopping about it, I can't just say go for it, but I am going to say go for it and do it. You'll be happy you did it.
Now, if I may, okay, a couple of things that I'm sure that if someone was listening to this who knows me very well is going to say, so why did you do Mary under general? Okay, and they're going to ask me this, right?
Right.
So, and I want to kind of be very blunt, and you can correct me if I'm wrong.
Oh,
Okay,
no,
so
you're probably right.
Okay, no, if I misspeak or I say something off, you correct me. Okay. We had a conversation about this. You come in for consultation. I take a look at your history, your physical. I get a gestalt about you, and I told you the way that I feel comfortable, not you, but I feel comfortable doing your case is putting you to sleep. Mm-hmm. Is that basically the run and exactly what it is?
Absolutely.
Yeah, so this is, I think, really important to people watching and trying to learn. Just because I mostly do local anesthesia, you don't get to come in here and just say, I want local. We've got to make sure that it's right for you, and it's the right decision based on patient's anxiety, patient's health history, all these different various things. Would you agree with that?
I agree, because I was a nervous wreck.
Yeah.
I have high anxiety, which I am getting better.
Yeah.
But I remember on our very first doctor visit, my foot was going 90-0 on the floor.
Mm-hmm. Yeah,
I was.
And so basically, when I see a patient like that, I can only imagine, I can goof you up to a certain extent in the operating room. And I told you this to your face. I said, God forbid, we start surgery, everything's great. Somewhere in the middle of surgery, you decide to have an anxiety attack, or you have an anxiety attack. Then what are we going to do? And then you looked at me and go, okay, I understand now. I mean, it was a kind of a mutual decision.
Oh yes, I'm glad I went under.
Okay.
Yes, absolutely.
Now, I want you, if you can talk to yourself, okay? I know you don't remember maybe every single moment of what you felt. There are, as I just said, there's a couple of big blocks of anxiety that you probably felt the night before surgery. Okay, I'm sure that was a bit of an anxiety-provoking, even no matter how well it's explained to you of what's going to happen, right?
I didn't sleep.
There you go. Okay. So if you could go back and talk to yourself, you have this time machine, you can go back knock on your door, talk to yourself, what would you say to yourself?
I overreacted. I mean, I don't know if that's
You
the
can say
word
it.
for it,
Yeah.
but I feel like it was much easier than I thought it was going to be.
Yeah?
And I recovered, I feel like, much quicker, which I know I did, because people still cannot believe that I had it done.
I was at a dinner party last night, okay? And one of the ladies, I rarely tell people what I do for a living, okay, at a dinner party. And one of the ladies there was talking about, and as soon as people figure out what I do, then it's like, well, I had a friend, that's what comes out, right? She was talking about one of her friends who had just eyelid surgery, okay? That's it, who is 15 days out from surgery, and they're just now getting all the stitches out. And she says she still looks bruised and swollen, and I just nodded my head, because to me, I mean, if you imagine, 2.5 weeks after surgery, you were out and about, and we did a full face rejuvenation on you.
I know.
Yeah.
I'm just thinking about that, how...
Different strokes for different folks.
Exactly.
Now, second part question. Okay. Once you finish surgery, you go home, okay? Then, there's one probably big relief when you kind of get, get your faculties going. I did it. I'm done. Okay? But then there's the second major step, right? Which is, now I gotta heal. Okay? I gotta go through the bruising, the swelling, the bandages, blah, 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 dot, 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 okay? And there's the second kind of round of anxiety that kicks in, different than the first one. Okay, again, Mary, you get to go back in time. I'm throwing you in the time capsule. You get to go back and talk to yourself. What would you say?
I think after you took the, what is it? The
Head wrap?
Yes, head wrap off. I felt better
Yeah.
after that. And within a couple of days, I was still bruised and swollen, but I felt better. I felt okay. I think the worst part of it was my husband constantly waking me up when I was trying to sleep to give me medication.
Yeah.
But I didn't feel, there was really no pain.
Yeah.
And all I could say is afterwards is, I'm glad I did it. I mean, I hate to keep saying that, but I am glad that I did it, And I looked at myself every time I got up, out of the chair, out of the bed. I would get up and go look in the mirror and turn all the lights in the bathroom on. And it was just like, wow.
Yeah.
Yes, it was
Cool.
great. Yeah.
I have one more thing to ask of you, and then I'm going to tell you something.
Okay.
Okay, so first of all, overall, okay, most of my interviews, I end with a question. There's 7+ billion people on Earth. 7+ billion people may be watching this someday, okay? And you are talking to them. You have open mic night, okay? As I said, there's another Mary in there, somewhere down there, who's feeling exactly what you felt. The anxiety, the thinking for years, the vacillating back and forth, all that whole thing. We hear this all day long, okay? So you have a chance to talk to her, okay? You can sit down, have tea with her, and you're saying something, okay? Woman to woman, friend to friend, what would you tell her?
I would tell her to read about it, to just think about everything she wants to do. And I'm just going to be honest with you, do research. I did a lot of research on everything. I talked to a lot of my friends who had it done, and they were thrilled. They even told me that I looked better than they did. They couldn't, still to this day, can't believe it. But I say, go and do what makes you happy. You have to do what makes you happy in life. Sure, having a tighter face isn't going to really make you happy, but it does. It takes a lot of, I didn't say insecurities away, but it makes me feel good about myself, and I'm glad that I did it, I'm happy.
Awesome. Awesome.
I'm happy. What do you want me to say? I'm happy.
No, exactly. Okay, so now I want to tell you what I want to tell you. First of all, I want to thank you. There's multiple things I'm going to thank you for. 1, for being my patient. 2, for listening to the things I told you, okay? It takes a lot, okay, to get past that inertia, whatever that word is, right? The fear. It takes a lot. Number 2, I want to thank you for listening, okay? And here's the reason why. I completely recognize that I may not be the easiest person to work with, okay? I am very obsessive compulsive, very detail oriented. And so, for example, one of the things, your statements that you said, do your research, figure out what it is that you want, which was some of your advice. I think that my overall methodology sometimes is a little absolute au contraire to that, because when someone comes to me, I tell them what I think, I listen to them, but I also tell them what I think they need. And I don't give up on that very easily. I mean, some parts I'm willing to negotiate, and some parts I just go, this is what's going to look good on you.
That's right.
Okay, and right? So,
Yes.
so, you know, it takes a lot of courage to just go, hey, listen, I'm going to listen to this guy. He does this and he's good at it, and I'm going to put my faith in it and go with that. So I appreciate that. Most importantly, I know you have, and to the people who are finally watching this video, I know you're probably going to say, why are her eyes blacked out or whatever my editor decides to do with her, because she wanted some degree of her privacy preserved, and so I have done that for her. But yet, despite her wanting her privacy preserved, she is willing to share these things with other women, because the network that we build in this office of all of our patients is pretty freaking amazing. Patients come in and say, I've seen her video. Oh, I loved what Mary had to say. I don't even remember a year from now who Mary was. And they show me the video. Like, oh, okay. You know, I mean, so there is this self-help group that we've just created online, which is pretty awesome. I never would have predicted that. So the fact that you're willing to share, because I think you can see the value of how what you say helps people as they go through this journey.
Right.
So I want to thank you for that. And while we have this opportunity for the record as well, there's a lot of other people here that have created this artwork we're looking at right now, okay, that usually don't get mentioned in these videos. And I think you can clearly see it takes a village to do what I do. I get to be the guy on the front page of my website and everybody looks at me, but I can't do what I get to do without Barbara and Rosa and Cassie and Sarah and all these people who take care of you through all those little things, like helping you in and out of the hyperbaric and helping you with your light and cleaning and answering questions and all those little details. And you know, they're damn good at what they do.
They're amazing. All of them are so sweet, so kind, professional, and that's what really impressed me.
And they know what they're doing. It's not Groundhog's Day, you know? They walk in like Super Bowl ready every day. So,
yes.
You know, so that's, I think, one of the things to people who are out there considering this type of surgery, it's not just the surgeon. It really is all of the supporting staff, because I think, Mary, you can attest to the fact you do have to use their services. You know, they help you on this process.
Oh, yes. Absolutely.
You know, I know for a fact for me, they help me, because there are times when I can take care of you, and there are times when I'm like, I'm the surgeon, I've done my part, and then Sarah has to come in and do all the huggy, feel good, lovey-dovey stuff.
They're wonderful.
Yeah.
But I need to thank you for being patient with me.
Well, thank you. I appreciate it. I appreciate it. I mean, it's something we, you know, I mean, I can understand that it's nerve-wracking, and when we're anxious and scared, we're not always at our 100% in terms of how we interact with people.
Right.
The person I see in front of me today is 180 degrees different from the person I saw the first time I met you in consultation, right? I
Yes,
mean,
correct.
there's no similarity between the two people. And it's probably because you were so scared just walking in that, you know, it's your ability to interact in that situation. And it's hard coming in and saying, hey, you know, my personal self-esteem issues are ... and I would like ... fix. It's a hard conversation to say.
I was afraid of the pain. A lot of it was the pain, and I didn't have it really.
Good.
You know, I mean, that was a big fear. And then, of course, normal that I thought maybe I might have some, you know, what if something goes wrong, you know.
Right.
But nothing for either one of them. I mean,
Good.
I didn't have any pain really, not that I can remember. And I'm very happy.
Preparation. It takes a village. I mean, you know, you get that little, it's a novel. The amount of stuff that we put in that book, tell you to do, not do, eat, drink, all that stuff. There's a lot of information. You know, a lot of this is to prep people so that they can have this kind of experience, because this is what I like getting every single time. Like, this is what I want, rinse, repeat. And you just figure out how to maximize probabilities of getting that.
That's another thing I want to tell people is you need to read the book, the whole thing. as soon as you get it. And you do need to do everything that it says. You know, make sure that everything Dr. Audrey tells you that it is, you do it, you know, and you keep it clean. You do all the face washing, just like you said, the skincare. I mean, all of that is so important. And I think that was a lot of it, you know, the icing on the face, using the roller and all of it. It helped. All the stuff that you gave me was amazing.
Good. All right. Any last words of wisdom to humanity?
Go for it.
All right.